thank you everybody for joining us today. I know we're a small and select group, but hopefully you'll get something from what I'm going to say to you today. So the webinar today, we thought, as we're in a new year, we thought we'd give you an update on what Positive About Down Syndrome can do for you this year. We have a few new initiatives that you might like to tell the parents that you come across, in your professional lives, signpost them to where they can get support if they need it. And I think also, hopefully, we're going to illustrate to you that the support we provide is considered really invaluable to parents that we support. So that we are the go-to place. In fact, that we cover most aspects of bringing up a child with Down syndrome from the point of pre-birth to beyond. So I'm going to tell you exactly what we do. So as you know, as a quick brief introduction as to what we do, we provide information to both parents and professionals. We have lots of peer support groups, and we offer our expert advice. We do training sessions for parents and professionals, and you know that we also campaign and lobby. Where Nicola and I, our founder and I, are both part of the National Down Syndrome policy group, and we're heavily involved in the APPG for Down syndrome, as well as supporting Liam Fox with the Down Syndrome Act, not on our own, obviously, in a bit bigger group. So generally what we do is we work really hard to make sure that every expectant parent and every new parent of a baby with Down syndrome is supported, and that they have access to the information that they need and they deserve, that we provide ongoing peer support. So from the moment that they have that diagnosis, whether it's antenatal or postnatal, we can provide support going forward. And also when that baby arrives, we can give them support and advice, but that's also to professionals as well. So our vision is in these little boxes, that that every parent, not, we don't want to miss parents. We don't want them to be have any adverse mental health issues because they've been missed and they haven't got the support and they're worrying. So our vision is that the arrival of every baby with Down syndrome is celebrated, making sure that those parents get congratulations as one of the first words that they hear when their baby is born, that every child has the opportunity to flourish and thrive with Down syndrome, that every family is cared for, empowered, that you all as professionals, that you feel empowered and educated and supported as well, that each student has the best education surrounding Down syndrome, every adult moving on, that they get the opportunities that they need to have a fulfilling life going forwards. And ultimately, our vision is that everyone with Down syndrome is included, valued and celebrated. No mean feat here. They're big missions. So we're involved in all of these aspects in terms of the support that we're able to provide. Some of which you may not know about. I mean, you may not know that we provide counselling, that we do information sessions for parents, as well as the training we do for professionals. We have, Makaton signing courses, and obviously campaigning. We have a whole load of resources that I'm going to tell you about. So you may only know about Positive About Down syndrome, which is more of our maternity arm of the charity Down Syndrome UK, which is our national charity. You may have heard of our Heart Buddy scheme, which is working really well. I'll tell you more about that in a minute. Pants for School, which is our toilet training initiative, which is, people are calling, groundbreaking, because this kind of thing has not been around before, specifically for toilet training children with Down syndrome. Our STAR, which is Support, Training and Resources, is our school kind of arm of the support. We've got early years development programs, which are making a real difference for those who are unable to access early years programs, if face to face. So we've got an online version of that. You probably don't know that one of our new initiatives is an EHCP support service. So all our children will need education healthcare plans, and that can be a real minefield for a lot of parents. And we now have the resources and the information all in one place, which I think is pretty unique, and also really handy for parents. DLA, disability living allowance, again, that's another thing that a lot of parents worry about, and find it hard to find the right support. And again, we have all that in one place. We've formed the Down Syndrome UK network, which is a network of local support groups. So we meet together every year, but we're also sharing our information, sharing our resources. And I think the difference that we make is the fact that we are a parent-led support organisation, support charity. So we know through our experience where the gaps are, especially the older ones like me, who've got older children with Down syndrome. We know where the gaps are. We know what it's like. We know how hard some aspects are. So we are filling those gaps. So in case you wanted to know statistics, these are the kind of numbers that we're supporting at the moment. We're proud to say that we've welcomed over 250 babies from our antenatal group moving forward. And, you know, our grandparents support group network is quite well populated, which is obviously an area where the support wasn't there previously. Our school support is well used as well. And in terms of professionals, we have, you know, quite a large number of maternity professionals that are on our network group. But we also have school professionals that we support as well. So just to show you, you know, how valued we are amongst parents, 90%, we did a survey last year to see what people thought of our support services, but also, you know, how can we improve them? What's missing? What do they wish that they had that we could provide? What did they struggle with? Where, you know, could they not find the information they needed in the setup that we have? So 90% of parents advised us that we are the go-to place for support, and nearly 90% said they by using our resources and the support we gave them, they felt empowered to support their child. And 95% of parents trust the information that they get from us. So that's, you know, high praise indeed. So you should know, if you've been to any of our webinars before, you should know about the publications that we provide. The Nobody Told Me book we provide free to maternity units, so please get in contact with us or your regional maternity coordinator. Hopefully you know who they are, but if you don't, do contact me and I'll put you in touch. So this is really well received, the Nobody Told Me book. It's stories from not just parents, but grandparents, siblings, friends of people with Down syndrome, and the aspirations of young people with Down syndrome themselves. I think we give these out to anyone who's in our antenatal group, and obviously you give them out to postnatal, well, and antenatal probably, but either way, we make sure that every parent gets one of those. The Little Orange Book of Knowledge is a postnatal collection of information that parents might need is to stop those cases from slipping through the net. It's telling parents what they need to know, like why do they need an occupational therapist? When should they get one? It's also got about teeth, it's got toilet training, and it's got benefit advice in there. But you can access both of those online, so do have a look at our website. We have information about heart surgery. This was one of the areas until recently, a lot of parents said that that's, you know, obviously one of the most stressful times in a parent's, you know, life, with their baby having to undergo open heart surgery, and there wasn't that support there. So now we have these lived experiences, so parents know what to expect. But we also have our Heart Buddy system, and you probably know that we've done an awful lot of research into breastfeeding. Again, there wasn't a lot of support before we came along on breastfeeding a baby with Down syndrome. So I'm kind of going to give you a little walk through our website, really, and tell you where, as a professional, you might like to get some advice, and also what we're able to provide in terms of supporting families. So this is a screenshot of our website. You can see, hopefully, at the top there's a professional section. Mine's actually blurred by my toolbar here, but there's a professional section on there. And as I said, we don't just have maternity professionals, we have also educational and healthcare professionals. So if you have a look on there, with the maternity section, you'll find an area where you can order online our maternity packs that we that we can send to you, which contains posters, postcards, and a few of our books. So you can do that online. On there, you'll be able to find your regional maternity coordinator. We have a small team of passionate parents, and their job is to make sure that maternity units have someone fairly local that they can talk to, and also make sure they get the advice that they need and the resources they need. So do try and find your regional maternity coordinator. Poor old Laura lives in Wales actually, and she's covering Wales, Scotland and Northern Ireland, but we feel like we're covering, you know, all areas of the UK. To find out who your regional maternity coordinator is. On that section of the website, you'll find links to our antenatal care pathway, which is an antenatal care pathway for pregnancies where Down syndrome is diagnosed or suspected. We're hoping that all hospitals will adopt that care pathway. Oh, somebody is making a lot of noise. Can you just mute your screen? Sorry. So thank you. So you can find a copy of that there, should you need it. Our place group for maternity professionals, the link is on there. And also all of the lunchtime webinars that we have done. So we have been doing this, for a year now, our lunchtime webinars, and all of our lunchtime webinars are accessible online. So that's where you'll find them. In terms of training, hopefully you know that we provide our lived experience training, which is online or face-to-face if we can manage it, but we do need expenses paid if we're going to be face-to-face. But face-to-face, it really is, I'm missing that, to be honest. So we work with maternity units, universities, GP surgeries, health visitors, anybody who'll listen to us, we'll provide some training to make sure that you're aware of parents' experiences about best practice and how to, you know, what poor practice looks like, so that you can make sure that you get that good practice. So this is just feedback from one of our midwifery students, said that I enjoyed the new perspective given on Down syndrome and how little changes like language can have a big significance on families and how they view and feel about their babies. I feel more equipped to signpost parents to get information and support, as well as supporting breastfeeding. So we train quite a lot of universities. We're targeting all the universities in the UK. And I do quite a lot of training to midwifery students, which is working out really well, actually. Get good feedback from that. As you know, we have a load of online support networks, from pregnancy to school. Our Great Expectations is for mums who are expecting a baby with Down syndrome, or at least have had a diagnosis or high chance screening result. We also have a similar group for expectant dads, so we're not ignoring the dads. It's not as well populated as the mums one, as you can imagine, but we've had really great feedback from that group that people are getting the advice and support they want in a very safe environment. So moving on, our new parents group obviously has different support that parents want from being a new parent. Moving on to preschool parents, I'll go into a bit more detail about the actual support in a moment. But because we have been, as an organisation, we've been going we're in our 7th year now. We are now moving up to primary school, which there really was a lack of support when it came to primary schools welcoming learners with Down syndrome. So my son is 14, so I'm in the secondary school phase now, and I have to say, I wish I had something like PADS and Down syndrome UK when, you know, I was going along my journey with Billy, because it would have saved me a lot of stress. The breastfeeding peer support, we are really lucky to have with us our breastfeeding coordinator, Sarah Ojar, who's got extensive experience around breastfeeding. She's been a peer supporter with the Breastfeeding Network, and she also volunteers on the National Breastfeeding Helpline. PADS is now part of the Breastfeeding Network, actually. And Nicola Ojar does training sessions, breastfeeding and infant feeding training sessions. So if that's something that you're interested in, please contact us, because she does really good training. In fact, our next webinar is going to be an update on breastfeeding, which she's going to take charge of. So Sarah's also done this Breastfeeding a Baby with Down Syndrome book, which you can access online as well. So you probably know, if you've been to any of our training, is that there is a misconception. It's quite widespread, actually, the misconception that babies with Down syndrome can't breastfeed. And Sarah has all the knowledge and expertise and advice within this book. So I would really recommend it, not just, for you to recommend to any mums that you come across that want to breastfeed, but also, as a professional, it's a really useful book, and it's got some information that would be useful to you. So the heart buddies, if you come across any babies where they have a heart defect, whether they need to have surgery or not, we have advice and a support that we can give them. Our heart buddy scheme works really well in the fact that we buddy up families of children that have had a particular surgery at a particular hospital, and so they get the emotional and the practical support. So that's the email address if you wanted to know any more about heart buddies. So we have supported 122 babies that have undergone heart surgery since we started this heart buddy scheme, and like I said, it's working really well in terms of families really rate the support that they get at the time they need it. And something you may not know about is that we do provide bereavement support if sadly a baby with Down syndrome passes away. So we have that support available to parents and grandparents. It's a closed online support network, and we provide counselling if needed. And thankfully, it's quite a small group. But again, the parents have said that it's somewhere where they can, really express their grief in a closed and understanding environment. So unfortunately, if you do come across any parents, do advise that we have a network support for that, because I don't think anywhere else has something like that. We do a bit of well-being as well. This is something we're planning on expanding. So we do have the counselling sessions, and that's not just for bereavement support. At any stage really, if they need counselling, then they can contact us. This is mainly really for our antenatal group. Sometimes they may take time to adjust to the fact that they're having a baby that they didn't expect. But also, for new parents, again, if it's taking them time to adjust. So we do counselling, one-to-one counselling or group counselling with our qualified counsellor. She did a webinar for us. If you want to know more about that, do check out the recorded webinar that we did last year. So we also have a parent that does yoga sessions for our parents. And I don't know if you know about Tom Fitz. This is Tom. He's actually Nicola Enoch, our founder's son. He does HIIT sessions, high intensity training. He's the Joe Wicks of the Down syndrome world. And he does online, these are free sessions, online HIIT sessions on a Sunday morning. My husband and my son do those. I don't do those. But he's really good. So, as a professional, those are open to anyone, but, to our families especially. But if you fancy joining a free HIIT session from, Tom, who's going places in the Keep Fit world, do get in contact, and I can put you in contact with how to join those groups. So we have a load of Facebook closed groups. As you can see, this is just, again, the tip of the iceberg. So we've got dads. This one here is the one for maternity professionals, but we have an eye care one. We also, so we've got optometrists, other healthcare professionals. If you're an optometrist here, or of an optometrist that would like to join this group, because obviously our children do have a lack of visual acuity, and it's a really good space to put all these specialists in one place. So in terms of health, we have a section on our website for all of these aspects of bringing up a child with Down syndrome. And I think it's really nice for parents to have all of those in one place. Things that you may not know about is the alopecia group. Alopecia is more common in our children. And again, we found parents don't know where to go. They don't know where to get the advice, and they think they're the only one. So we have a group for them, which you may not know about. Sleep apnea, again, very scary time for families, if their baby is suffering from sleep apnea or they suspect they might be suffering from sleep apnea, and it gives them advice on, what would be the next steps, who should they see, who should they contact, what does it involve, what's a sleep study, why do they need one. Hirschsprung's, that's something that is more common in children with Down syndrome, and we've got a really good information sheet about Hirschsprung's that explains what it is and going forward what support they might need. Infantile spasms, really scary again for some parents. They don't know what they look like, they don't know what that involves, the implications of that, and we have an infantile spasm expert online again. But these, any query that they might have as a parent, they just need to, if they're part of the new parents or the expectant parents group, well, any of our groups actually, if they put on their, I think my son's having, infantile spasm, then, we direct them to our expert and move on from there. So I'm going to tell you a bit more about our speech and language support which is new to us as well, which you won't know about, I wouldn't have thought. So Pants for School, we're really, really proud of Pants for School. I know you probably don't want to talk about toilet training over your lunchtime, but this is a scheme that we have developed with June Rogers, who's from Bladder and Bowel UK, so another national organisation. We haven't just gone into it and written our own rules. We're under the expert eye of June Rogers, who's an expert in bladder and bowel from the Bladder and Bowel Network. So we have a 4-step program, toilet training program, which is, I think, unique to us and our children with Down syndrome. We found that a lot of parents were being misinformed about when they should toilet train their child. That happened to me, actually. I was told that Billy wouldn't understand toilet training till he was, 5 or 6. So we didn't bother trying to toilet train him, and we went through absolute toilet training hell that lasted over a year. And now, thanks to Pants for School, which is the idea, it's in the title, we're hoping to get all our children in pants before they go to school, like every other child, most children. And it's working really well that now our children are being toilet trained alongside their mainstream peers. It does take a bit of effort, and we do have boot camps so that when families have decided to, commit to toilet training, we have these weekly boot camps for 4 weeks. So they don't go, oh, I've had enough of it already. They can talk to other parents that are already having enough of it and talk to our expert, June and Nicola, as to, how to move things forward if they're in a bit of rut, and share experiences. It's working really well. And some people do say that that's a bit of a lifesaver and a game changer, which I would imagine it is. I wish I'd had something like that. So it's not just about the actual toilet training part of it. We have for schools, we have an intimate care plan that schools can look at. Like I said, we've got an information sheet on Hirschsprung's, good practice guidelines for professionals, and top toileting tips. So when the toileting happens, hopefully it'll happen before school. If it doesn't, we have the best practice guidelines for when they do go into schools, how that professionals can support the families at home to make sure that they get to that toilet training mecca. And so, like I say, it's working really well. We've had some really great successes. We have a lot of children with Down syndrome, as you know, suffer from constipation from early years, and we found that families said that they didn't know where to get advice about that. A lot of them didn't know about it either. So we have a fact sheet again, which is, all of this is available online. So do signpost any families that you come across to our online resources, because it's all there. You may know about our early intervention programs. We found that a lot of the early intervention programs are provided by local charities, not by local authorities. And if you are unable to get to those local charities for whatever reason, if you don't drive, or if you work and or it's just not for you, joining in with a load of strangers face to face, we provide these online now. And again, I think these have made a big difference to those families that weren't able to access the early intervention groups. So we have these available online, and all the information is on our website. I sound like I'm, selling you a brand. Well, I guess I am in some respects. So yes, so there you can have a look at those online, signpost your family to those online. The other thing we found that parents were lacking was physiotherapy, early physiotherapy, or that they were being discharged from physiotherapy quite early. And we're lucky to have an expert physiotherapist on board who's also a parent, and she has some really innovative ways of teaching our children how to crawl and how to stand and all of those gross motor skills. But being a parent herself and talking to other parents, she's got some really great ideas. So we have these online physiotherapy sessions, which are specific to being a parent of a child with Down syndrome. New to us, I guess, last year, moving into primary school, like I said, that a lot of schools are not ready to welcome learners with Down syndrome. It turns out that the reason previously people with Down syndrome weren't that successful in schools, a few decades ago, is that we didn't know that they have a unique learning profile, which is, the premise for the Down Syndrome Act generally is the fact that our children have a unique learning profile, and they also have a speech and language disorder. It's not a delay, it's a disorder. It's more complex than being a delay. So we now have that expert advice so that when families, their child goes to nursery or to school, so the professionals know where to get the information they need to welcome a learner with Down syndrome, but also so that the parents know how to support their child at home and what to make sure that they feel empowered to knowing that their school know how to help their child reach their full potential within having that specific learning profile associated with Down syndrome. So we've got advice for professionals. Choosing a primary school, oh my goodness, that's a real minefield when you have a child with Down syndrome. So we've got some advice on that, and as well as choosing what you should be looking for in nursery schools, and promoting good practice for professionals and for parents, actually making sure that their schools are adhering to that, and also signposting them to Down syndrome specific resources. A new thing that we have as well is our EHCP advice and support. Like I said previously, there wasn't anywhere for a lot of families to go to get all in one place where people can discuss their EHCPs. There's a lot of variation within different boroughs. It's a bit of a postcode lottery as to whether you get a lot of provision or not so much provision, or whether you get a good EHCP or not a good EHCP. This is again what we're hoping the Down Syndrome Act is going to help with, and make it more of a level playing field wherever you are within the UK. We've got school Down syndrome awareness assemblies on there, so we're making sure that people aren't reinventing the wheel. If they want to go to school and have an awareness assembly, we have all the slides there. So that again is working really well, and I wish we'd had something like that when Billy started school. Moving on, secondary school parents, this is work in progress for us. We've spent a lot of our time on our maternity section and supporting early years. We are branching out into secondary schools, but it's not as well populated in terms of the resources that we have at the moment. So that's something that we're working on, as well as young people and adults. We have a support. We have a network for them to have a chat in. But again, this is not what our field of expertise as yet, but we are aware that we're starting these kind of aspects of supporting young people with Down syndrome themselves, which is obviously really important. In terms of information sharing sessions, we have a load of information sharing sessions for parents that go. I couldn't fit it all into one slide, so I've just put from behavioural boot camps to power of attorney. So if parents are worried about a particular aspect of bringing up their child with Down syndrome, signpost them to our website, and hopefully we may have information sharing sessions. We have quite a few on a monthly rolling term. And new ones pop up all the time. So I would suggest that you get your parents to take a look at our website to see what's coming up. But so what is to illustrate that we're going right from the early stages, to power of attorney. So when they reach adulthood, it's a whole different ball game. And we're wanting to hopefully empower our parents to prepare for what the next level is, bringing up their child with Down syndrome. This is brand new as well, because we're very lucky to have recruited Becky Baxter. Oh, actually, I haven't put her name on there. sorry about that. So Dr. Becky Baxter is a experienced and specialist speech and language therapist who's been doing been a Down syndrome specialist for over 15, 16 years now. So she's now our Director of Education and Speech and Language Therapy. She will be delivering training as well. If anybody needs any speech and language, Down syndrome specialist speech and language therapy training, do signpost any therapist you know to us, because like I said, the people with Down syndrome don't have a speech and language delay, they have a speech and language disorder. And it's a common misconception amongst a lot of therapists is that we're just dealing with the delay. And Becky's done the research around it. So what the service that she offers is pretty unique as well. So she's part of our she delivers early development groups, interventions for school-age children, communication groups for young adults. That's an area which is really lacking as well in many boroughs. Down syndrome specific communication groups for young adults, making sure that they're preparing for adulthood and that independence. So she's able to provide those, and training in schools, concerning literacy, numeracy, behaviour, friendships. Friendships is an issue perhaps that a lot of our children with Down syndrome, because they don't have that social communication, doesn't come very naturally to them because of their disorder. So that she provides really, really invaluable information and expertise, which we're really, really pleased to have her on board. I'm sorry, Becky, that I didn't put your name on my slide. So this is just to show you that it's not just online. We're also providing opportunities for our parents to meet. We have an annual party in the park. We actually have 3, I think now. We have 2 in one place and 1 further north. So we're hoping to, you know, get our families connected in person as well as online. And these have been really successful, and they're getting bigger and bigger every year. So, and thankfully the weather's been good I think we've done it over the last 3 years. It's been pretty good, and so it's not just face-to-face support that we're providing. We do offer that opportunity for them to meet in person. So this is just a snapshot of the feedback that we've had, saying, you know, that PADS has been an absolute lifeline. Without it, I don't know how we would have coped. From feeling scared and alone, we can now see an exciting, positive future for our son, and know that PADS is there to hold our hands all the way. I won't read all of these out, but you know, again, this is just the tip of the iceberg, saying that, you know, for example, nobody gets it unless you're actually in the same situation. And I think as an organisation, the fact that we are a parent-led group means that we are really filling those gaps that parents want. So I've given you a bit of a whistle stop into the support that we're able to provide. I really hope it has been useful. Just to let you know of our next webinars that we have planned for you, we're repeating our breastfeeding webinar. I mean, the content will be different, obviously, but the need is still there to tell you what we've been doing in terms of breastfeeding support. And Sarah's going to give you all the advice that she has on breastfeeding baby with Down syndrome. Looking over here, the one after that in March is our Down syndrome awareness webinar. There's Down syndrome awareness week, which is running from, I think, the 20th of March. It covers the 21st of March, which is World Down Syndrome Day. So do get in contact with us if you want to do any events within your maternity units, or if you want any special resources, or if you want anything to display for World Down Syndrome Day. Do get in contact with us, because we have a load of things that we can bring your way. So that on Down Syndrome Awareness Week, we have 4 young people with Down syndrome again to tell you about their lives. And last year it was really well attended. Actually, it was a really nice webinar to be part of. And then we're going to, then in April, we've got health visitors, how we support families, so how we can support health visitors, support their families. And then the next one we've got planned is in May, which is paediatricians. So do spread the word if you know it, you know, to your paediatricians and your health visitors, that we will be covering them in our next webinar.